Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Infections and pregnancy. Introduction. If you are pregnant, an infection can be more than just a problem for you. Some infections can be dangerous to your baby. The best way you can help yourself and your baby is to try to avoid infections. There are many tips discussed in this program to help you prevent infections. This program will help you understand infections and pregnancy, including tips on preventing infections. It discusses some examples of infections in pregnant women and treatment options. A special section on HIV/AIDS and pregnancy is also included. Infections and pregnancy. Pregnant women, like all children and adults, may develop infections. Infections during pregnancy have more possible complications. Infections can cause problems for both the mother and the baby. Many treatments for infections may be unsafe to use while pregnant. You may not always know if you have an infection. Sometimes you may not even feel sick. If you think you might have an infection or think you are at risk, see your healthcare provider. The best approach is to try to avoid infections, especially while you are pregnant. For example, washing your hands frequently and avoiding people who are sick are just two ways that you can avoid infections. Types of infections. There are many different types of infections that a woman can get during pregnancy. This section looks at some of the different types of infections that may cause problems during pregnancy or delivery. Group B streptococcus, or GBS, is one infection that may cause problems during delivery. This infection often doesn't cause any symptoms and is tested for late in the pregnancy. If a woman is infected, she could pass the infection onto her baby during delivery. GBS can cause lung infections, blood infections, and meningitis in your baby. Women should ask their healthcare provider about being tested for GBS if they are pregnant. Genital herpes is one example of an STD infection that may be passed to the baby during childbirth. Although only a small percentage of pregnant women with genital herpes pass it on to their newborns, it can cause serious problems with the brain and other internal organs. Another infection that may cause problems during pregnancy is the parvovirus B19. It is also known as fifth disease. Most women are immune to this virus since most have already been infected sometime in their childhood. Usually, an infection of fifth disease doesn't affect pregnancy. However, sometimes parvovirus B19 will cause the unborn baby to have severe anemia. The woman exposed to the virus may also have a miscarriage. Cytomegalovirus infection, or CMV, is another infection that can affect pregnancy. It is passed through sexual contact or contact with body fluids like urine or saliva. An infected mother passes CMV to her unborn baby. Most babies with CMV never have health problems. However, it may cause premature birth, small size at birth, small head size, and seizures. It can also cause problems with the lungs, liver, and spleen. Sometimes CMV can cause permanent health problems or disabilities. Toxoplasmosis is an infection that can cause problems for a baby during pregnancy. You can get toxoplasmosis from cat feces and fruits or vegetables. Most babies infected with toxoplasmosis don't have symptoms at birth. However, they can develop serious symptoms later in life. This can include blindness or mental disability. Another infection that can cause problems during pregnancy is listeria. Listeria is a type of bacteria found in soil, water, and sometimes on plants. Most listeria infections are caused by eating contaminated foods. An infection caused by listeria can be passed to an unborn baby through the placenta. The mother may not even show signs of illness. This can lead to miscarriage, premature delivery, serious health problems for the newborn, stillbirth.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
HIV/AIDS and pregnancy. HIV stands for Human Immunodeficiency Virus. It kills or damages the body's immune system cells. AIDS stands for Acquired Immunodeficiency Syndrome. It is the most advanced stage of infection with HIV. HIV most often spreads through unprotected sex with an infected person. It may also spread by sharing drug needles or through contact with the blood of an infected person. The first signs of HIV infection may be swollen glands and flu-like symptoms. These may come and go a month or two after infection. Severe symptoms may not appear until months or years later. A blood test can tell if you have HIV infection. All pregnant women should be tested for HIV early in the pregnancy. Special precautions may need to be taken to protect your baby. If you have HIV/AIDS and find out you are pregnant or think you may be pregnant, you should let your healthcare provider know as soon as possible. Some HIV/AIDS medicines may harm your baby. Your healthcare provider may want you to take different medicines or change the doses. It is also possible to give HIV to your baby. This is most likely to happen around the time you give birth. For this reason, treatment during this time is very important for protecting your baby from infection. Several treatments can help prevent the virus from spreading to your baby. Your healthcare provider can recommend the best one for you. Your baby will also need to be treated for at least the first 6 weeks of life. Regular testing will be needed to find out if your baby is infected. Treatment of infections. Only some medicines and vaccines are safe during pregnancy. Ask your healthcare provider about how best to protect you and your baby. Antibiotics may be used to treat some infections during pregnancy. Antibiotics may be given during labor to treat GBS. They may also be used to treat listeria. Medications are available to treat infections of genital herpes and toxoplasmosis during pregnancy. However, these medicines don't get rid of an infection completely. A mother infected with parvovirus B19 may be monitored more closely during her pregnancy. If the unborn baby appears to be ill, there are special diagnostic and treatment options available. Unfortunately, there is no treatment available for pregnant women infected with CMV. The treatments for CMV infection have serious side effects and are not approved for use in pregnant women. It is always better to prevent infections rather than trying to treat them. The next few sections discuss tips for preventing infections. While these tips cannot prevent all infections, you can greatly reduce your risk by following this advice. Hygiene and hand washing. Practicing good hygiene habits is an important way to prevent infections during pregnancy. Frequent hand washing is one example. Most infections are spread by the human hand. This means keeping our hands clean is one of the most important things we can do to avoid getting infected or spreading infections to people around us. Always wash your hands with soap and water after using the bathroom or when they look and feel dirty. You should also wash your hands properly after changing diapers, gardening or touching dirt or soil, getting saliva on your hands, handling pets. Also make sure you wash your hands while preparing food and before eating. It is especially important to wash your hands after touching raw meat, raw eggs, or unwashed vegetables. Wash your hands frequently if you are around people who are sick. If possible, you should try to avoid being around people who are sick in the first place. When around children, you should wash your hands often. Their saliva and urine might contain a virus that can be dangerous to you and your unborn baby. Also, try not to share forks, cups, or food with young children for the same reason. If soap and running water aren't available, you may use alcohol-based hand gel. This also helps to kill germs that can cause infections. Other prevention tips. There are also ways to prevent infections other than frequent hand washing. This section offers some general tips for pregnant women to prevent infections. Cooking your meat until it is well done is one simple way to prevent infections. The juices should run clear, and there should be no pink inside. Also, don't eat hot dogs, luncheon meats, or deli meats unless they are reheated until steaming hot. These undercooked meats and processed meats might contain harmful bacteria. Another way to prevent infections is by avoiding unpasteurized or raw milk. This includes foods made from raw milk. Unpasteurized products can contain harmful bacteria. Dirty cat litter might contain a harmful parasite. Have someone else change the cat litter if you are pregnant. If you must change the cat litter yourself, be sure to wear gloves and wash your hands afterwards. You should also avoid wild or pet rodents and their droppings while pregnant. Some rodents might carry a harmful virus. If you have a pet rodent, have someone else care for it until after your baby arrives. Pregnant women should also get tested for sexually transmitted diseases, or STDs. Some people that have an STD don't feel sick, but if you do have an STD, talk to your healthcare provider about how you can reduce the chance that your baby will become sick. Pregnant women should also avoid traveling to certain high-risk areas to prevent infections. Check with your healthcare provider if you plan to travel out of the country while pregnant. Vaccinations. Vaccinations are another way infections may be prevented. Talk to your healthcare provider about which vaccines you may need. Some vaccines are recommended before you become pregnant. These vaccines may not be safe to get during pregnancy. Make an appointment with your healthcare provider before you start trying to get pregnant so that you can get the right vaccinations. Other vaccines may be given during pregnancy or right after delivery. Having the right vaccinations at the right time can help keep you healthy. It can also help keep your baby from getting very sick or having lifelong health problems. Children and other family members should also be up to date with immunizations. This reduces the chances of a pregnant woman being exposed to infections. It also protects the baby. People who are pregnant or recently pregnant are more likely to get severely ill with COVID-19 compared with people who are not pregnant. Getting a COVID-19 vaccine can help protect you from severe illness from COVID-19. COVID-19 vaccination is recommended for people who are pregnant, breastfeeding, trying to get pregnant now, or might become pregnant in the future.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. If you are pregnant, an infection can be more than just a problem for you. Some infections can be dangerous to your baby. Many treatments for infections may be unsafe to use while pregnant. The best way you can help yourself and your baby is to try to avoid infections. There are many tips discussed in this program to help you prevent infections. Some common infections can cause serious problems during pregnancy. Treatment depends on the infection. Some infections don't have a treatment approved for use in pregnancy. You won't always know if you have an infection. Sometimes you won't even feel sick. If you think you might have an infection or think you are at risk, see your healthcare provider.
Thank you for using Explain.